Radio. Yep. I'm interested in your thoughts about what influences your beliefs, behaviors, and feelings as someone who is involved in the care of patients. The survey looks at 14 attributes considered critical to an efficient emergency medical services system. During our interview, we'll be focusing on only two of them: legislation and regulation, and medical direction. Legislation refers to either the Ministry of Health, Chief Medical Officer, CDEMA, or an authority having jurisdiction who is authorized to serve as the lead agency to coordinate EMS activities locally or across the Caribbean. Legislation and regulation could require activities from among various agencies to be integrated in order to facilitate a Caribbean-wide standard for EMS systems. It also refers to the implementation of laws that provide protection from liability for EMS field and medical direction for personnel operating in the field when dealing with unusual situations. It also allows them to serve as liaison that may interface with other EMS entities. Let's start with some questions about legislation and regulation. Are you able to tell me about your beliefs in general regarding the emergency medical services system and patient care here in Barbados?
My beliefs?
Yes.
Well, you can guide me if I go off track in any way, but first, I guess if I can give you a little of my background.
Okay.
I have been an emergency room nurse for most of my career. So that kind of, guides my direction through. You can say I'm biased.
That's okay.
But in regards to legislation that governs our practice, we have a pretty clear guideline, but sometimes I wonder if the legislation is really geared toward us, or if there's a ulterior political type background for everything that's done. We know that the money is the bottom line, right? And this is a public hospital where the services that are provided are for the general public who are unable to pay or who choose to come here when they don't want to pay. But I believe that the care should be free for all, and that we have that responsibility to provide the care. There's somehow a disjoint between the services where the ambulance service here and the fire service, everybody's a separate entity, as opposed to overseas where you would see one body responding to the particular incident with the same person. We're somehow, I think, at a disadvantage in that respect, because you have a wastage of resources. A lot of time is wasted when you get a mass casualty or something, and the ambulance might respond or the police might respond, then has to wait for all the other entities to get there. A lot of time is wasted. But I believe that with the resources we have, we do a pretty good job in terms of providing the emergency care. However, the hospital has outgrown the population, and we are not able to provide for the number now. It's always a challenge. I don't know if I've answered what you wanted.
No worries. What do you believe is the role of legislation and regulation for pre-hospital EMS providers in Barbados?
I think that role is to set the parameters first in relation to liability. It's so much can happen in the pre-hospital setting that may influence how the providers respond or give care because of fear of doing something and then they're not covered by the legislation. It kind of limit how you do things.
Understood.
Because everybody wants to stay within the law. You don't want to have to go to court and give account for a lot of things that can go wrong.
Okay.
So that I think the legislation also protects you when you practice, because if you're sure of the guidelines and clear on what you're covered to do, then you can practice within those boundaries.
Okay. So based on that, could you think of an example in the past that you think legislation may have impacted service delivery, that you believe legislation impacted service delivery or care of a patient?
I can think of an incident that would have happened, but and this is where endangerment of the providers' lives come into play. The standards and the practice is that the ambulance would go and collect the patient, and they actually stay on the scene to do vital signs, take further history. And there was a group that actually it was a shooting, and the gunman actually got into the ambulance and shot the man again, killed him.
Wow.
So they're afraid to take the patient and go to the hospital or go to a safer place, but they should. They're following the guidelines, but sometimes that outcome could probably have been different if they had gone against what the guidelines were then.
Okay. So you told me about your beliefs about legislation and regulation of pre-hospital providers, what your beliefs are. Can you tell me about your feelings towards it?
About the pre-hospital care?
About legislation and
The
regulation
legislation.
of pre-hospital providers across the Caribbean.
One of the things that I've been doing some reading when I was doing a study before too, and looking at our challenges and the way they're dealt with in other countries, like our overcrowded department, the process of bringing the patients here, as opposed to we don't have another hospital that we can divert. So I felt that we're practicing with what we have, but if we had legislation to say that technicians, EMTs have, or paramedics have the authority to determine that a patient just needs some painkillers and can go to another facility, that would help us.
Okay.
So we're kind of disadvantaged there in that we're still, I think, behind in a way.
Yeah. When do you think these feelings about that perspective kind of surfaced?
From working in the department, actually being there and being overwhelmed, and some of the cases you see, are minor,
Mm-hmm.
but they can't. There's no legislation. They're not covered, so they can't. I've seen. Well, we watch a lot of TV, and you see the EMTs respond and see the patient and then determine, look, you don't need to go to the emergency room. You can. They can write two Panadols or something, and they can go to the polyclinic the next day or whatever.
So you're thinking how? So now I want to know, generally speaking, in terms of behaviors. That's all most of the behavior that you really you just discussed. How does how could you tell me how does could legislation positively influence you or your peers or even the ambulance providers? Is that an example of one of those ways it could positively influence their behaviors?
Yes, because if even as the nurse, when they get to the hospital, we don't have legislation or for nurse practitioners here. Oh. If we did, a lot of the crowding could be avoided, because you can have, even if they're working under the hospital umbrella, can see and treat a lot of the minor cases. So we're looking at, I think it would be very cost effective. Sometimes a patient will sit for hours to wait to be seen, and they could be treated and go. So then we end up overcrowding the area, frustrating everybody, staff suffering from burnout, and we can't do anything.
So that's the negative influence of not having legislation that covers that particular scope
right.
Of
so
practice.
If there was legislation, I believe that the number, the crowd that we saw or we see daily could be reduced. But there's another feeling that I have to that. I always wonder how the medical team now would respond to us,
As in the EMS providers?
Yes. As practitioners. The public, you're not paying, but you still have persons who have private practices. And I wonder if they would see it positively.
So your thoughts are that the EMS providers may feel negative about a non-doctor or a nurse practitioner taking on the care of the patient that they bring to A&E?
No, the
customer,
the doctor, the medical personnel.
Oh.
I always wondered if they would take too kindly to there being the nurse practitioner, because it's always a power struggle. And
power struggle between who?
Medical and nursing staff.
When you say medical, what do you mean?
Doctors.
Okay.
And I don't know if people are... We always say this is a doctor's hospital. Lots of things get done when there's an influence of the doctor. So it always comes down to the nurse as the one, or the EMTs taking a back seat.
Interesting. Now let's move on to some questions about medical direction. Medical direction as in each carrying country having a qualified emergency medical director who oversees the country's EMS services and the system, and it provides guidance. That person provides guidance to all the EMS providers. It refers to sometimes an appointment of an EMS medical director for each Caribbean country. Medical direction often refers to or requires involvement in clinical care, system design, the scope of practice, credentialing, population-based care, occupational health of the providers, the EMS providers, and also encouraging and initiating research. So tell me about your beliefs regarding the medical direction here in Barbados for pre-hospital providers.
Medical direction. No, we have a head of the ambulance service here, and I am not sure that they're actually maximizing their true potential. I am not sure of the process if, well, Dr. Bayer would report to the chief medical officer and the head of A&E. There's a good relationship between A&E and them because they have originated from A&E here, from our emergency, but I don't know if that is because there was a personal relationship before. In terms of guiding, the emergency director can guide practice as well and help the other services to coordinate the general response. So, but I am not sure to what extent that is done right now.
So why do you believe they're not
Sure.
maximizing the EMS medical director in Barbados?
I believe that every entity tries to thinking how to put it. We're kind of, there's a lot of separation and disjointed. The cohesiveness is not there. Every team, wants the power. I think it's a big power issue too, because you may not want to take orders from me because you think I am just an EMT, I'm just, the paramedic. But I might be, an authority in my field, and I can give you valuable insight into things that I can relate to help make an overall program successful. But it's selfish sometimes too. But with our emergency response and disaster program that we have here now, there is a place for the emergency director, because that person can help to influence the same legislation. And we don't tend not to have those persons who should be sitting in parliament. We always have ideas of what should be done, how it should be done, but there's always a problem with, it takes a long time, let me say, for the to get past a lot of red tape. So it calls for a total change in the mindset. And if you are given the authority, then persons will listen to you if it's not only political.
So how do you think that impacts patient care?
Guess who suffers?
Who?
The patient. Because if you really have, we say we have the patient as the most important person in the whole cycle, but yet we're disadvantaging patients when we take a personal stance. I want to make myself look good. You want to make yourself look good. So I am pushing my agenda, you pushing yours. As opposed to coming together and meeting as a true body to iron out all these problems and to actually gain what it is you want for the patient.
So your feelings, tell me about your feelings now. We talked about beliefs. Tell me about the feelings regarding medical direction of these pre-hospital providers. What are your feelings?
Sometimes I am just I believe that the I keep saying I believe, I feel
Yeah.
that I say the patient suffers, and it tends to be the public patient who that person who suffers, not the private one can usually go and access services otherwise. So they are not as affected, and then again, it's persons of a certain ilk, even though they're living here, they push that we have a good health service, but then persons get ill and you will see they will take a plane and go to someplace else to seek care. So it means then I ask myself, do you really have the trust in your system then if you're doing that? And what are you saying to others who are looking on? You're saying the health service is good, we're providing this for you, but when you get sick, you pack up and go somewhere else. So you're actually saying it's good enough for you, but not for me.
You seem very passionate about the care being provided to patients and the need for medical direction, or the direction that's being provided by an EMS medical director. Would you agree?
I agree with that. Mm-hmm.
Yeah. So what are your thoughts? Go ahead.
I was thinking too that before, no, Barbados is a small island, but the ambulance service used to be based in one location. There is an improvement now where you have another location in the north, and that is a plus. I am happy about that, because usually you would rush a lot of patients here, and by the time they get here, there's hardly something you can do, or CPR would have been in progress from St. Lucie, and it took that ambulance had to leave here to go there and come back. But now they can dispatch one from Arch Hall, which improves the outcome. So that's a good thing. I believe so. I don't have the numbers to show to say that X number has survived.
Probably,
but yes.
So when we talk about behaviors, we talk about behaviors of any doctors, any nurses, and ambulance workers. What do you think are some things that are influencing the behaviors of any physicians who may provide medical direction? Their behaviors.
Socialization of doctors here. I told you that it's a doctor's hospital, and doctors are socialized to believe that they're the most important person. That's how I see it. And it is only in departments I find that you will have cohesiveness between the doctors and the nurses, but they're like on the general wards, it is not that cohesive. And I think it's partly because they were socialized that way.
So why do you think those things influence their behaviors?
Because sorry. It influences because they come with this mindset that they're not supposed to take orders from somebody. They're supposed to give the orders. So unless you're somebody strong enough to really assert yourself, then they will tend to walk over you all the time. And it happens here, not as much in departments, as I said to you, but we still have it happening across the hospital.
So how do you think medical direction positively influences the behaviors of A&E personnel, or even the pre-hospital personnel or environment?
That director, that person has to be, well, if they're a good manager, a good leader, they would be able to help motivate the staff to, get them up to the level where they understand the importance of each other, interact on a professional basis. It's like just being able to motivate their staff, and they have the authority, so persons will listen to them.
So, negatively, tell me, how do you think medical direction can negatively influence the behaviors of your peers, or even the A&E doctors, or the pre-hospital providers?
How it can negatively. I see more. It could negatively impact if that person is the person that I just described to you as believing that they're superior to the other staff, because you can only teach what you know. You can only influence people by your standards and your values, what you believe. So if you're not, if you don't have the welfare of the patient as your priority, that's how you would influence the staff. But how do you determine that somebody has negatively, or how do you make a case if you've picked up or you suspect that? That's not something that you can easily pinpoint.
Okay. So going back to feelings, a couple last questions. Would you characterize your feelings about issues involved in medical direction for pre-hospital providers as being negative, indifferent, or positive?
I can't say a negative. In this instance, I think it's more positive here with us now, and as I said, I think it all has to do with the relationship. It's like the network that was there before. So the direction is by somebody that knows the A&E side, knows the ambulance side, knows, so everybody pretty much knows and responds well to the head of the ambulance service. So, but in terms of the systems for continuing care outside of the hospital, like calling in to get directions on giving medication. Well, the EMTs here don't give medications, but they can set up IVs, and that has been, before it was just scoop and run, but now EMTs set up IVs, and by the time the patient gets here, they've had the IV access and stuff. So it helps to minimize then the length between care when the person gets here. So outcomes should be better as well.
Okay. Last question, going back to legislation and regulation, would you characterize your feelings about issues involving legislation and regulation in the context of EMS? How would you characterize your feelings? As either negative, indifferent, or positive?
I have a lot of positive feelings, but there are some things that have bothered me from way back, and one of the things is, well, there are advanced directives. We don't have advanced directives here. And often you would see an order or given a verbal directive that this somebody's not for resuscitation, or but since we don't have that, it always makes me, I'm always very careful, used to be always careful not to take that and let that prevent me from giving care, especially in the resuscitation. A patient who may deteriorate, and it's actually written, do not resuscitate. Mm-hmm. But knowing that there's no legislation to cover me for that, I am going to go ahead and do everything that I can for the patient. When the doctor gets there and says, well, stop CPR or stop whatever, that's fine, but I am not covered to not do anything. Mm-hmm. And I've never been to court to answer for anything untoward, and I wouldn't like to. Mm-hmm. The hospital has a lawyer, and they tell us that the lawyer, of course, will represent you and guide you and whatever, but I don't want to cause harm to anybody, and certainly a case like that where I wouldn't have a leg to stand on, I wouldn't want to be in that position. So I everything I do, I always try to find out, to know what you're covered for, what you're not covered for, what you should do, what you shouldn't do, because I practice it by the book.
Yeah. So in the context of pre-hospital EMS, your feelings are similar.
Yes, but I believe I would like to see the legislation covering them to do more.
Well, in closing, how long have you been in the profession?
About 27 years.
We've covered everything I planned to cover. Do you have anything else you'd like to add? I know it went a little long, and I really appreciate it.
Actually, I didn't even realize it was okay. I hope that